This is back to school week for much of the province, and I know that many Albertans continue to have worries. This is natural. As I have said before, we are living in an unprecedented time, and there are no risk-free options when it comes to COVID-19. This includes not just risks from COVID-19, but also the risks that our control measures introduce. As we move into a new normal of living with COVID, we must consider all of those risks to our children's health. In schools, it is critical to limit exposures as well as limiting spread of the virus as much as possible. It is also vital that we support effective learning environments which mitigate other risks to our children, such as impacts to their educational and social development. Though minor differences exist, Alberta's plan is generally consistent with other provinces across Canada and many countries around the world. This includes the concept of easing distancing restrictions in the classroom to enable an effective learning environment. In recent discussions that I've had about the release of Order 33 and about masking and distancing in schools, there seem to be two embedded questions that many parents have. One is why we have not required 2 meters of distance between desks in a classroom, and the second is why masks are not required in classrooms when the 2-meter distancing is not possible. In my remarks earlier this week, I focused on answering the second question, and today I would like to spend a bit of time on the first. When our guidance was first released on school reopening in June, the distancing measures in classrooms were identical to what they are now. That is, where 2 meters is possible between seated students, that is the goal. But where it is not possible, maximum spacing with students not facing each other is an acceptable alternative. This guidance was developed after many conversations on the benefits and risks of moving to a model such as Scenario 2, where it would be possible to keep 2 meters of distance between all students in a classroom. In Scenario 2, classes are split in half. Students spend half the week in a classroom and half the week at home doing remote learning. This option enables smaller class sizes and wider distancing, but it brings other risks and challenges. This includes additional costs of childcare for parents who are working, or the possibility that some families may need to rely on grandparents for that half of the week that students are not at school, which could put those older Albertans at risk. In public health, we have the responsibility of making our best recommendations for the overall health of Albertans. As I said earlier, this includes recommendations to minimize the risk of COVID spread and also minimizing the impacts that these interventions have on our children's overall well-being. Facilitating our children's ability to return to in-school classes has a significant overall benefit to their health and the long-term health of our population. And I therefore felt that this was an acceptable adjustment to make. What's important when masks are added to the mix of preventive measures against COVID-19 is that they're used in conjunction with other preventive measures, but also that they become part of our new normal. And so when we're looking at schools, and to your question about whether or not having students wear them all day potentially creates some risks of students touching their faces, I think that it's going to be an adjustment. This is going to be a part of learning in this new school environment where teachers and school staff and students are going to be working together to compassionately remind each other about the new measures and about the need to be consistent. I do believe that with consistency over time, we can collectively, both the students in those schools as well as teachers and other school staff, adjust and create those habits. I think with respect to wearing masks all day and those school boards that have chosen to make that a part of their policy, again, each school board has the ability to make decisions based on what is happening in their respective jurisdiction, the transmission rates, and they're able to have those discussions with their local medical officers of health. So I think that we will be watching, of course, in all of the schools that go back to see if there are risks associated with some of these different policies or benefits. and that's going to be a part of our ongoing monitoring. But right now, again, I think we are all making the best decisions we can about the health of students and trying to mitigate those risks that you mentioned. But it comes back again to encouraging and supporting each other to build the habits in the new normal that will keep us all protected for the longer term, which is what we need to do because COVID-19 is not going away.